Our second guest is Katy Swain, nurse practitioner at Novant Health, Oceanside Family Medicine and Convenient Care. Well, welcome to the show, Katy. I'm so excited to have you here.
Thank you.
Good. Now, usually I ask what brought you to Brunswick County, but I know that you grew up here.
I did.
So talk to us a little bit about your education and your background and how you left Brunswick County and where you ended up.
Okay, sure. So I did grow up here. I went to UNCW for my undergraduate and did nursing. I did that, moved away, worked in Charleston for a little while, decided to go back to graduate school. So went back to Duke for my graduate program and wound up back here with my family. My fiance and I wanted to be closer to our family, so here we are.
So now you're a nurse practitioner.
Yes.
And you are here locally with your family and in a new practice,
yes,
right?
That's right.
Well, good. Well, I believe you're at Novant Health, Oceanside Family Medicine and Convenient Care.
That's right.
And what is your role there, Katy?
I'm a family nurse practitioner, so I work in the convenient care and the family practice. So I take patients of my own and I see walk-ins in our convenient care.
And let's talk about that convenient care a little bit.
Sure.
Now, I know they have extended hours, I believe, other than what the practice has.
That's right.
So let's talk a little bit about the availability of appointments and things
Sure.
like that. And can you just walk in? And
You can. We are open. The convenient care is open 7 days a week.
7 days a week.
That's right. Monday through Friday, we're open from 8 to 8. And on Saturday, 9 to 6, Sunday, noon to 5.
Noon to 5.
So, and that's walk-in hours. You walk in and you see whatever practitioner is able to see you at that time.
Can you make an appointment in convenient care, or is it totally walk-in?
You can. In fact, a lot of people do that. They'll call and see, the earliest they can get in, and we like to get you scheduled so you don't have to come to the office and wait.
Great. And then you said that you do take patients of your own. So if I wanted to call, or one of our viewers wanted an appointment with you, they would just call the main number and schedule with you.
That's right.
During a time that you're working.
Yeah.
Great, great. Well, I know that you're a nurse practitioner, and we've talked about that a good bit in the past, but very simply, what is the difference between a nurse and a nurse practitioner?
A nurse practitioner has gone back and gotten, some people go back for, their PhD, for their doctorate, and I've gone back for a master's. So, you have the advanced education. It's an advanced practice nurse who, we lots of times are referred to as mid-levels. We work in collaboration with physicians in providing patients the best care they can get.
Can you write prescriptions?
Yes, I can.
Well, that's very good. I think sometimes physicians need that extra hand, and so it's a great supplement to their practices. So where is the practice located? I think it's a relatively new building.
It is. It's a really nice building. It's located off of Cellar Street in Charlotte, which is near the Food Line and the DMV. And
everybody knows where the DMV is.
That's right. So we're right there. It's on a back road. I think it's 5145 Sellers Street, and right near the DMV, so it shouldn't be too hard to find.
It's a very nice building.
It is.
It's really a nice area, and there's plenty of parking. It's a huge parking lot.
Yeah, and believe it or not, we're really actually outgrowing it. So
I've heard Dr. Eisenhower say that. Let's talk about a little bit about the other providers that are there. I know it's Dr. Eisenhower's practice, and he has 3 other physicians in the practice.
That's correct. So there's Dr. Eisenhower, who has a very busy practice.
Yes, he does.
And then there's Dr. Pritz, Clark Pritz, and Dr. Angela Thompson. And then there is Tiffany Lewis, PA, Marie Wheatley, nurse practitioner, and myself. And then there's Bonnie Hood and John Fillmore, nurse practitioner, who they work mostly in the convenient care.
I see. Well, that is a big practice.
It is. We're growing by leaps and bounds, so we have a lot to offer.
And speaking of having a lot to offer, what all kind of services do you offer there?
We have a lot. We have a full lab service. We have X-ray. We have ultrasound, and we have a bone density scanner. So.
Oh, wow.
Yeah, we have a lot to offer right there in our office.
So do you do women's health?
We do. We do. And we have a lot of, options to choose from as far as, different providers and,
Yeah, you have male and female, and it would be a one-stop shop for women.
Definitely.
Yeah. Now, we've talked about all the nurse practitioners there and the PAs and the physicians. And all of you have a certain interest, I'm sure. And do you have a favorite?
I think right now what I enjoy focusing on is preventative care, getting people in and trying to keep them healthy versus, working the backwards way and they're sick and trying to back up.
Wait.
And sometimes, we have to go that route, but I like to try and focus on keeping people healthy.
Now, you did say you're currently accepting new patients.
Yes.
And could you give us the phone number at the practice?
It's 910-754-4441. So it's a pretty easy phone number to remember.
It is, 4441. And so any of our viewers out there who would like to make an appointment can just call the main number.
That's right.
And ask to schedule an appointment with you.
Yes.
And then they would be seen in one area or the other, depending on where the room is, right?
That's right, yep.
Well, thanks again for being on the show today.
Thank you for
having me. It's been a pleasure having you, a pleasure getting to know you, and welcome back to Brunswick County.
Thank you so much.
You're welcome.